as Jackie said, and I am with the ISPCC Childline Therapeutic Support Team. I'm based in Limerick, having worked in Limerick City and Limerick County over the last number of years, and the work that I do involves working directly with young people. I've worked with a wide range of young people for a variety of different reasons, and also providing support to parents. And a huge area of work that we get involved in within the ISPCC is building resilience amongst young people. So what I'd really like to do this morning is share the experience that I've had working directly with young people and my colleagues about how we build resilience and how we talk about resilience with young people. And I really hope then by the end of today's webinar that you as parents and carers will really have gained an insight into what you can do on an everyday level in order to nurture your child's resilience. Okay, so what we're going to do, what I'd like to do is to start with, just if I can move my slideshow, it seems to have paused. Okay. So just to give you a little bit of background as to what we do at ISPCC Childline. So we are Ireland's national child protection charity, and fundamental to what we do and our purpose is to listen to young people, to empower them, to strengthen their resilience, and to enable them to live their best possible lives. So you can see a huge area of work that we involve ourselves in is listening to young people and giving them a voice. And by doing that, we're hoping that we can strengthen their resilience and help them to cope with the ups and downs of life that may occur as they go through childhood and into adulthood. So we have three main services within the ISPCC Childline. We have our listening service, which is a phone and text and web service that's available to young people they can contact that service 24 hours a day, 365 days of the year. So that is a very universal service which we provide to young people across the country. Our Childline Therapeutic Service, which I've been involved in for the last number of years, is one-to-one support work with young people, where we are a mobile service and we will go and work with the young person in a place that's comfortable and safe for them to meet us, and where they feel they can work with us and open up about some of the challenges they're encountering, and we'll devise support plans to help build their resilience and their coping skills. And our community services then moves into working with young people and staff and volunteers in the community sector, whether that's in schools, whether that's in youth clubs, whether that's in sports clubs. And we aim to kind of just always bear in mind that young people have a voice, and to encourage them to speak up and to talk about any issues that might be affecting them. What I'd like to do for the next 35-40 minutes is share with you what we do at the ISPCC in terms of what is resilience. I think it's really important to understand what is resilience, because it's certainly a term over the last couple of months when COVID changed our lives for now and has had a really direct impact on our lives. It's certainly something that we've heard mentioned, whether it's on news bulletins, whether it's on social media, is how we need to build our resilience at these difficult times. So what I'd really like to do is talk about what is resilience, because in order to work in it, in order to strengthen it, we really need to know what it means. And it really is, it's an easy concept once we understand what resilience is. I think it's easy then to transfer that into practical steps that you and I can do to strengthen our child's resilience. So what we'll do then towards the end of the webinar is look at real practical everyday things that can occur with you and your child at home, out and about when you're chatting with them, to help strengthen their resilience. So one theory of resilience that I'd like to share with you today is by Ginsbergs, and he was a practitioner, a pediatrician in the United States, and he really became intrigued by what is it that allows some young people to be able to deal with certain challenging circumstances. So he came up with this theory, which I think is really applicable. It's about the capacity, resilience is the capacity to rise above difficult circumstances. allowing our children to exist in this less than perfect world while moving forward with optimism and confidence. So really, resilience is all about bouncing back. It really is. The concept of resilience is the ability to rise above a difficult circumstance and allowing our children to exist in this less than perfect world. We need to be aware that there are challenges out there. Life isn't perfect. There are ups and downs, and our children are going to hit these roadblocks, hurdles in their life. And what we need to do is understand that and then really, I suppose, work around what are the age appropriate challenges that our children are okay to deal with. Of course, there's going to be things that will overwhelm them. And especially at the moment with COVID and, restrictions, we need to bear in mind how much information they need to know. But equally so, they need to have a say and be able to talk about the impact this has on them and how they may be able to cope with it. And by doing that and including children in building resilience and nurturing their resilience, what we're aiming to do is help them to move forward with optimism and confidence. And for me, they're the key words about resilience and nurturing resilience, is encouraging young people to move forward with optimism and confidence. The feelings that we have today, the experiences that we are having now will move, they will change, but we have to take on board the impact they've had on us. And being resilient is being able to move forward with that optimism and confidence. The good thing to understand about resilience is we can work on it all the time. So some points I put up here that I hope you can see is that we're not born with a certain level of resilience. And it's not like, well, if you haven't developed it by the age of 10, then you won't, because that's certainly not the case. The good thing about understanding more about resilience is that you can be aware that we're not born with a certain amount of it, and it is something that we can develop at all times in our lives. So even if in the past you felt you or your child or your children maybe have had challenges and maybe, you haven't responded in the way that you feel you would like to have. Well, the good thing to know is if you hit challenges again in your life, you can now adapt and you can change those coping strategies, and so can your children. It does take effort. Building resilience takes effort. Even for me, I spend my working life talking to young people about resilience, and I need to step back every so often and become aware of what are my current coping strategies? How am I managing the ups and downs of life? So it does take effort. And I might find something that works for now that in 6 months' time may not be working as effectively. So I'm going to have to change my coping strategy. I'm going to change how I approach these challenges. And another key point to remember is being resilient is not about avoiding challenges. So if we want our young people to develop a certain level of resilience, what we're going to have to do is let them face certain age-appropriate challenges in their life. And, being resilient isn't about pushing away the negative feelings or about avoiding challenges or about wrapping each other up in cotton wool so we don't need to, be aware of the reality of the challenges that are out there. It's actually, going with your child and facing these challenges and supporting each other and doing it in an age-appropriate way. So as time goes on and young people grow up, that the challenges might become a little bit more significant, but there too, their coping strategies and their ability to rely on their own resilience should grow as well. And you're never too young or you're never too old to start thinking, talking, and practicing resilience building skills. The good thing is, even at a young age, when toddlers are starting to, play games with their siblings, learning how to share, learning how to take turns and follow rules, all of those key skills that you're, teaching your toddler, they're all building blocks of resilience. And therefore, later on in life, as teenagers and as young adults, they're the core skills of resilience that you're going to be building on. But the good thing about resilience is we can always adapt and we can always maneuver our resilience skills to be a little bit more to fit the needs of the current challenges that we're facing. And just to give you a little bit more of a background around what is resilience, it is about managing your physical, your emotional, and your social self. And that's the same for children as well. an important concept in resilience. It isn't just how you manage situations from an emotional point of view. You know, we're very much in tune with our feelings, but are we in tune also with our physical well-being? And do we look after our physical well-being? And that includes, you know, how much sleep we're getting, how much activity we're having, and, you know, in terms of time online and on phones in comparison to maybe time outdoors, nutrition. Our social self is also very, very important. You know, when we're meeting challenges in our life, do we tend to isolate and try to manage them on our own? Or are we good at seeking support and asking somebody maybe for a chat to talk through something? Do we encourage our children to talk about things even outside the home and maybe approach a teacher or a friend? So being resilient is thinking about, you know, your overall well-being, both from a physical and emotional and a social self perspective. And when you're doing that, what you're doing is giving yourself a wide range of positive and adaptive coping strategies. So you're not just relying on your emotional well-being. And, you know, I'm going to say, for example, if you were feeling anxious about something, if you just try to manage that anxiety without trying to look at other factors that might help, such as doing a physical activity, such as talking to a friend or reaching out to a colleague, then you're minimizing your resilience skills. But if you look at all three pillars here, it will help you to have a lot of different support networks available to you. I always think of building resilience if, you know, if you were a fisherman or a woman and you were going out to sea and there was potentially a storm out there, but you didn't really know when it was going to really kick in and get bad. Well, you would go out to sea, but you would make a certain amount of plans in order to help you if a negative situation did arise. So you might have a boat. You would have a boat, but you might have an engine on the boat. You might have oars on the boat. You might have a life raft or a dinghy. You might have a radio system, and you might have told somebody on land where you're going, what time you're due back. So if you go out to sea and there's no need and everything goes straight forward, that's great. But if a mild or moderate storm did occur, then you could start looking at your backup that you have. So if the engine failed, you have the oars, you have the radio system. And this is what resilience building is all about. It's not relying on one technique to help you manage a challenge. It's having like a toolbox of different strategies you can use to back yourself up and manage yourself if you do hit a storm in your life. And resilience with our children is the same as well. It's having a wide range of different strategies that he or she can fall back on. They may have one or two that they feel very comfortable using, but being resilient is thinking, is there anything else I could do to manage this situation that is having a negative impact on me or is a challenge for me right now? So I'd like to spend a couple of minutes now, if that's okay, talking to you about the model of resilience that we use at the ISPCC Childline Therapeutic Service and also in our Childline listening service as well when we're working with young people. And this is by Edith Grotsberg, and she developed a huge wealth of research on theories and models of resilience. And in the ISPCC Childline service, we have adopted this because it's a very practical, user-friendly model that I'd like to share with you, because I really feel this is something then that you can think about and talk about with your children at home. So it is the I am, I can, I have model of resilience. And what it does is it looks at our core, three core foundations of resilience that you and I as adults or our children can use in terms of dealing with challenges in our lives. So the first one is around I am, and that is very much focused on how do I feel about myself? How do I think about myself? How do I rate myself in terms of coping with this current problem? So we, in the ISPCC, when we're working with a young person, we will look at all three factors of their life, their I am, I can, I have. So I am, we're looking to kind of assess and talk about their self-esteem, self-confidence, how they think and talk about themselves. Do they give themselves praise, or do they kind of tend to underestimate their ability to manage and to maybe interact with other people? I can is very much around what can I do to manage this situation, whatever it might be. What can I do right now or down the road in a few weeks' time to manage these feelings that I'm currently having, to manage this challenge in my life? You know, what can I do about it? And then I have looks at who do I have in my life that can help me out if I need it. It's really important that we encourage young people to reach out and seek support, you know, and not to try and always deal with problems on your own. A really good factor in building resilience is to think about it is absolutely okay to talk to people and to reach out and ask for support at different times in our lives. And I think that's something as adults we also need to work on and remember that it's good to talk, and it's good to know who are the people around me that I can talk to if I need to. So as I mentioned, in the ISPCC Childline services, we will use these core elements of a young person's life, and we will really look through these with them and have discussions with them around how they're feeling about themselves, how they're feeling about their ability to control and manage their feelings and the situation that they're currently in, and who do they feel they have that can support them if needed. And the good thing to know is that we don't all need to have these three pillars at a very optimal level all the time. So there will be times that I'll be feeling fairly confident in my own ability, and then there might be other times when that's a little bit reduced, and that's okay. But what we really want to avoid is a young person who feels one of these key areas of their life is really suffering or really struggling. So for example, if I was working with a young person who was currently, you know, facing exams and really, you know, overwhelmed and feeling stressed out by it, my work would be to look at these core elements and think about how are they feeling about themselves, how are they managing these feelings and their anxiety, and who do they have to support them. And what we would very, you know, easily identify is if, for example, they felt, yeah, I'm feeling quite confident in my own ability, and I know I'm anxious and I know I'm stressed out, but I know I can get through it. But I just feel I have nobody to talk to. And I just feel there's nobody who really gets how I'm feeling, and I'm feeling a little isolated. Well, then we would move into kind of promoting tools that the young person could use in terms of building up their social support and their, you know, building the I have pillar, if you like. So they feel that, yeah, you know, it is good that they feel they have confidence and competency in their own ability. But do they feel they've people around them that can support them and chat to them and maybe just help them manage that stress when they need it? So that's the kind of model of resilience that I think at home, you know, would be really important to kind of start thinking about with your children and young people, to start looking at, you know, how is their I am barometer and their thermometer in terms of how do they feel about themselves, how do they feel in terms of their own coping skills, and do they feel they have an element of support around them and people that they can discuss their challenges with at different times. So what I'd like to do is just share 3 easy to use techniques that you could use at home in terms of having discussions around these 3 elements of resilience. So the first one is I am. I'm just going to take a quick drink of water. The first one is I am, and this is a really fun, pleasant thing to do with a young person. And if you have teenage children or you feel they're a little bit old for this, well, this is something that you can do, you know, through a conversation while going for a drive or out and about doing something together. So what we would do is we would have a sheet of paper and split it into 4 sections. And the first one we would ask and give the young person a bit of time to say, you know, have a think about some of the things that you're currently good at. And we'd ask them to write that into the box. And then the box below, have a think about and write down some of the things that you're getting better at and that you're currently working on. And then with the parents or their carers, we'd ask them to write down, can you tell us a special memory that you have of a time you and your son or daughter or children had together? And also, can you write down a time when you felt really proud of your son or daughter? So this is something you could do at home with your child or children, grandchildren, you know what I mean? And or something you can do by having conversations with them driving in the car. And the whole purpose of this is to really get young people to think about, even though we're going through challenges, even though things can be difficult, I have good qualities that I'm proud of. And I have things that I'm working on all the time because I want to be able to improve or manage my coping skills or new skills or new things that I'm trying to do. And also it's about relating well with your child and saying, you know what, I'm really proud of you. And I really like it when I see you sharing with your brother or sister or staying calm when I know they may have broken your toy. I am so proud of you being able to do that. So I am is really about promoting self-worth, self-confidence. The I Can Care tag. And again, this is a really lovely thing to share with a young person. And it's all about encouraging them to express their feelings. So for any young person who's going through a difficult time, it's really good to get them to open up and talk about the impact this is having on them. That, you know, I can't emphasize enough how we need to encourage young people to say out loud how they're feeling inside. So the care tag is like, you know, if you bought a new piece of clothes and you had to put it in the washing machine, you'd be very careful about reading the care tag and having to think about, do I put it in a delicate wash? Do I put it in a cold wash? So if you were a child and you were feeling, you know, a little bit sad or anxious or angry or confused, wouldn't it be great if you could have a care tag that you could share with somebody and say, this is how I'm currently feeling? So what we would do with young people that we're working with is ask them, you know, write down those feelings and write down when I, you know, so for example, when I come home from school, I am feeling exhausted and I need a break for half an hour. Or when I have to go to bed, I am feeling lonely and I need a story or some time with mom and dad, whatever it might be. So what we're getting young people, and if you have a persistent, you know, a young person who has persistent feelings and you really want them to kind of manage and talk about how they're feeling, these care tags are a great way of really getting it down on paper and opening up the whole discussion about when we feel a certain way, it is going to affect us and it does affect our behavior. And sometimes we need other people to understand how we're feeling. And finally, the I have, and that's all about reaching out and seeking support and being able to talk to other people. We ask young people to draw their hand on a sheet of paper and then to have a think about who are the 5 go-to people in their lives that they feel they could talk to if they ever wanted a chat or advice or support. And this is really good practical thing for them to understand that no matter what, no matter how big or small their worries are, that there's people around them that they can talk to. So it might be that they have a really good friend. It might be that it might be their mom or their dad or a grandparent. It could be a teacher. It could be a coach. It could be a leader at a youth club. You name it. And it is really, really powerful when we do this with young people for them to really understand that I have people around me that look out for me, that, you know, support me, and that I can go to if ever I need to have a chat about anything in particular. And that's really good resilience building, is to understand that, you know, when we face a problem or when there's a challenge in our lives, we're not on our own. So that's just the theory of resilience that I really wanted to share with you today. I am, I can, I have. And if you ever want to look it up online, there's a lot more information that can go into a little bit more detail if you like. But I think it's really good to just think with regard to your own young people and your children is, you know, I am is self-confidence. I can manage my behaviors and I have people around me to support me if I need it. These are conversations that can be had at the dinner table, in the car, at any point with the young people in your lives. And another concept that I wanted to share with you today was Ginsbergs, who I already mentioned at the start, and his kind of, when he was thinking about in his work, working directly with young people, he really started to think about what are the key factors or attributes in a young person that seems to help them cope with adversity and challenges. And this is really, really good to think about this in terms of our own young people in our lives, because he identified these as key building blocks of resilience. So if we can encourage these 7 C's in our young people, in our children from a very young age, then we're really helping to nurture their resilience. So what they was, the first one was competence. So we need to think about how much are we letting the young people, our children do for themselves. I know I'm guilty of this, and I'm a mom myself, and I've been very guilty over the years, especially when they're young and life is busy, is jumping in and doing things for them. You know, I really, whether it's making their breakfast, making their lunch, brushing their hair, putting their jacket on, whatever it might be, getting the bags out to the car in the morning, you know, I always felt if I can get that done and get them out to school on time, job done. But what I realized recently when my kids returned to school in September, I started to think, okay, you know, certainly my younger ones were getting old enough to make their own lunch. And I thought, oh, they're really not going to like this now because I've had it ready for them. But when I said it to them one morning, I said, okay, you know, back to school next week now. So what you're going to do from here on in is make your own lunch, but there's always going to be X, Y, and Z in the press, and you can pick and choose what you want to put in your sandwich, what fruit you take, whatever it might be. And I was really expecting that they might go, oh no, that's another job, we're busy, we're tired. But it was actually quite the opposite. And they were only delighted that I felt they were now old enough to make their own sandwich and decide for themselves what they were going to take for lunch within reason. And it really reminded me of, we need to be always encouraging their own competency and their own ability to do things for themselves. Because what we want then later on in life is not to be shy to give things a go. We want them to give things a go. And even if they don't work out, that they've tried, and we promote that. And what we're doing is building self-confidence. And that goes back to the I am we were talking about a minute ago, that it's so important that we build self-confidence. And we say to our children, you know, I know you can do this. I know I might have been doing that for you for the last few months, but you know what? I really see now that you're well able to do this. And that's real confidence building, whether it's going to the shop for some messages, whether it's walking home from school, whether it's doing their homework without having to have everything checked. You know, you can think it through yourself, but we need to encourage young people to have confidence in their own ability. Ginsberg also came up with connection as a key component of resilience. So are we encouraging our young people to have connections with other family members, friends, neighborhood groups, youth clubs, school groups, whatever it might be, that they feel a sense of connection to? I remember before hearing a comment about, you know, young people having to find their own tribe. And I think that's really, really important, that we let young people find those people that they, and friends and family, that they have a connection with. It might be an elderly aunt or uncle, it might be a younger cousin, it might be the school council at school, it might be the band club, you know, in town, whatever it is. And it may not be something we had ever shown an interest in, but if that's where our young people and children are finding their interest and their passion, then we need to encourage those connections. And this is about building their sense of character and their sense of own identity. I know who I am, and you're encouraging young people to think about what makes you happy, who do you like being with, what kind of things have you an interest in, what kind of things do you like standing up for, whether it's, you know, you're listening to a radio piece and it's maybe something about something that's happening in another country or COVID. You know, we have discussions about how do you feel about that, what do you think, you know, is this something you've ever chatted amongst your friends about? So you're developing that whole sense of character. Another C that Ginsberg looked at was contribution. And this is about, are we encouraging our young people to not only have a place in society and within their own community, but also to maybe help others out, and to have that two-way traffic of, it's good for me to help other people, and it's equally good for me then to maybe sometimes get help from others. So having a sense of contribution, maybe as they get older, doing some voluntary work, or at the moment during COVID, doing something nice for a neighbor, a family member. And it's that sense of, it's really good to help others out and look beyond our own needs and encourage young people to start thinking about the needs of others as well. And that is about building resilience and coping skills. You know, in terms of building resilience, are we encouraging young people to look at different ways of coping with problems and managing situations? Do we have chats with them about the stresses and strains of school, friends, relationships, or do we just hope they're coping themselves? I think it's really good that you start talking to young people at even a young age when they have a problem, whether it's a test coming up or whether it's falling out with their best friend and being quite sad about that, is that we have chats with them about, how are you coping and how does this make you feel? And finally, the seventh C was around, you know, teaching young people about control. And that's not just about self-control, but also about, there are things in life you cannot control. There are things that are outside of our ability to control, but there's lots of things we can manage. And this is so true, say at the moment with COVID, our everyday life. So for example, going back to the, you know, a young person who might have big exams coming up and feeling really overwhelmed, whether it's a junior cert, leaving cert, whether it's Christmas exams, you know, you name it, it does impact on some young people. So what we need to do is break down, well, what can you control and what is out of your control? So for example, the questions that come up on the paper are so out of your control, but what is in control is how much study you do, how, you know, how you prepare for this exam, how, you know, how you plan your study over the next couple of weeks or months. And that's giving them a sense of control and an intrinsic sense of control. And external things that are out of our control, we might have to let go. And that's really good build a toolbox, a foundation for building resilience, is having that strong sense of, I can only do what I can do for now, and I need to let other things go. So they're key skills in terms of building resilience: competency, confidence, connection, character, contribution, coping, and control. So what I'd like to do now, just for the next 5 or 6 minutes, is just go through some very practical things that I think should help you nurture your child's resilience. If it's at home, you know, if it's, you know, a family member, a niece, a nephew, a son, a daughter, a granddaughter, grandson, you name it. You know, it's really good. For me, what I would say is share your past experiences with your children. Don't be afraid to talk about what it was like for you growing up and maybe challenges you faced. That's really good for young people to relate to you. They might look up to you and see you as quite, you know, and, you know, organized, calm person, but to understand, oh yeah, when you were younger, you know, maybe you didn't know what to do when you're leaving cert, or you didn't know what subjects to pick in secondary school, but you got through it, and express with your children how you did that. How did it make you feel at the time, not knowing certain things, or maybe having a fallout with a friend, or having to move house or move school. So talk about your experiences and talk about how that made you feel. I think it's really good if we're going to open up the door and encourage young people to talk about their own feelings, then we need to start at home and we need to share our own feelings with young people. And this can happen about everyday events. You know, if you hear something that has happened in the locality or something that's happening further afield on the news, is to have discussions. You know, how does that make you feel when you hear that? What do you think about the current situation, whatever it might be? And share your feelings and your thoughts too. Then if we move into problem solving with young people as adults and as parents, sometimes, and I've been guilty of it myself, is we think we know we have the answer. And when they're come up across a problem in their lives, we think we know exactly what they should do to remedy it. But actually what I'd suggest to you is that you take a step back and you work through this problem with your child. So for example, if they are having a difficulty in school, and perhaps they're in secondary school and they're finding a particular subject really difficult, we as parents could ring in, organize a meeting with the teacher over the phone at the moment and try and work this problem out. But what I think would be really good is to include the child in this and have a chat with them about what would you like to do about this problem? What would help you? So we really go at the pace of the child, whatever that problem might be, and we involve them in the decision making. So what you're doing is you're encouraging them to think through the problem and also think through what could be a possible solution. So the next time they hit this issue or something similar, they might feel, oh, I remember when this happened before and I did X, Y, and Z, and I'm going to give that a try again. That is core resilience and building and strengthening resilience building. And also encouraging them to think about and talk about from mistakes they may have made in the past. So very important to think if they're a challenge in their life and something, whatever it might be, so they're moving school and they're going into secondary school, for example, and they're worried about making new friends and finding their way around the school, and very real concerns, is to think about, okay, what would help you? And what have you done in the past that's worked well? And what have you done in the past that didn't go so well for you? And what would you change about this, next chapter in terms of moving into a new school? What would help you to get through it? So it might be like in the past, they didn't talk to anybody and they just kept it to themselves and the problem seemed to get worse. So by talking about that, you're saying, okay, well, that's really good to identify that. So the next time you have a problem or a worry, what would you do differently? And again, it's about exploring options and always including young people in the decision making. So if they have an issue or a problem, what would they like to see happen? What can they do and what can you do to help them manage this problem? And that's really important in terms of exploring options. And sometimes our young people will come up with an option that we're not too keen on. They may decide to do nothing for a while. They may decide to sit and think about it. And we might be thinking, we really need to hit this head on. And it is about having a discussion with your child. And it really depends on their age and the severity of the problem. But if you step back and you think, do you know what? They're old enough now to work this through, and I'm going to support them and I'm going to be there for them, but I'm going to let them manage this situation and go at their own pace, then that's a really good skill to be able to develop as well. Encouraging independence is very important, like was mentioned, in terms of developing competency, whatever it might be, and whatever age your children are, is that we're always encouraging them to do something for themselves, whether it's after dinner that they can bring their plate to the sink or into the dishwasher, whether it's helping around the house and doing a few jobs, or whether it's, they have to go somewhere and they might go on public transport, or they might, meet friends, whatever it might be, that we're encouraging them to think independently and to be able to do things for themselves. What we don't want is by the age of 18 or 19, when we're expecting young people to perhaps go and get a job, even a bit younger, go to college, sometimes move home and be super independent. But from the age of 5, 6, 11, 12, we haven't encouraged them to be independent at all. That's a huge leap to expect them to be able to make. So what I would say is at a very young age, whatever it might be, brushing their hair, drying their hair, that you're encouraging independence at all stages of their life, making their lunches like the one I did recently, walking home from school, making plans with their own friends, and you having to kind of have trust in them that, they're able to manage that. And you it's something to get used to for yourself as a parent, but key skills in terms of building resilience for your child. And acknowledge when they try. So, we want young people to not give up, and we want them to think it's always worth trying something new. So we don't always look for the final outcome and success, but we look for any attempts, and we praise any attempts for our young people. Like, for example, if, we've been really working on them trying not to fight with their brother and sister, and we see them walking away, and we see them really trying to be patient and be calm, it's so important that we praise that. And we encourage helpfulness as well, you know, whatever it might be, sharing at home, doing something nice for somebody else, drawing a picture to cheer up a neighbor, whatever it might be. And that's moving young people's thinking from not only their own needs, but also how lovely it is to think about the needs of others. And if I can do something to, you know, cheer somebody up or do a good deed for somebody else, that's encouraging them to have a sense of, you know, community, which is very, very important as well. And like I mentioned earlier, but praise is a key component of nurturing resilience, and not just praising a positive or a successful outcome, but also praising any attempt. You know, if you have a son or daughter and their job is to put the bins out on a Thursday evening and they do it, well, if you don't praise them for that, you know, they might stop doing it, or they might become a little bit fed up that they're doing this job and nobody notices. So what I would say is, even if it's something that's simple and it's mundane, and sure, why wouldn't they do it? But always just, for me, I think it's so important to always just say, thanks a million for doing that. That was a great help. Or if you catch them being good, sometimes we can focus a lot on, you know, things that are going wrong and maybe things that, you know, haven't worked out as well as we would have liked. But I think it's really important that we always praise any attempt. And reframing is, and I know I'm whizzing through these because I want to make some time at the end for question and answers, but reframing is how we encourage young people to look at situations. And we as adults need to be very careful of how we're talking and expressing our views around our children. If we're constantly always looking at the negative and, you know, not looking at any of the positive issues in a situation, then we're going to encourage our young people to do the same. So for example, at the moment, young people are really being affected by not being able to do certain sports, clubs, meet friends, meet family members, and it really is having an impact on them. And while we can't take that away, what we can reframe is, I know this is really difficult and I know you're really missing your friends at the moment, but I'm delighted at the weekends that we can spend a little bit of extra time together. And how about we do something fun this Saturday? So you're reframing the situation. You can't change it, but what you can do is change the perspective. And I think it's the glass half empty or the glass half full way of looking at things. And it's difficult at times because sometimes it's hard to find the positives. But if you can, you know, it's always good to promote and praise the positive outcomes as well. And just quickly before I wrap up, a balanced lifestyle is very, very important. So we need to look after our physical well-being, our emotional well-being, our social well-being. If it's a young person who's, you know, in exam year, that we encourage a really good balanced lifestyle. Equally so for young people, getting out and getting some fresh air, meeting friends, family is very important. Getting to know their interests and their online world. And the reason I put that in is, you know, it's very important in terms of building resilience. We need young people to feel they can come to us and talk to us if they have an issue or a concern. But if we've stepped back from their online world and we don't know anything about Snapchat or Fortnite or TikTok, but then they have a problem on any of these platforms, well, they're going to presume we don't understand and we don't get it. So it's really important. There's a very good website called webwise.ie. And if you really want to look in and see, you know, get an overview of these different apps and games that young people are enjoying at the moment, I would suggest that you look on that website. So then you can have chats with young people and say, listen, I know you love TikTok, but, you know, I have heard there's one or two things that might go wrong or could be a challenge. So I always want you to know you can talk to me about them. And finally is, I suppose, the bottom line is, in order to build resilience, we can't avoid challenges. If we want young people to bounce back, if we want them to rise above challenges and move forward with optimism and confidence, we really need to be able to allow them face certain challenges and be there with them, have their back, be right behind them, but let them steer their way through these challenges. So just before we move into the Q&A, what I'd like to do is just, I suppose, what a saying I like, it's an old African saying, but it takes a village to raise a child. It's just on a final note, remember that as parents, you are key role models and carers and grandparents and aunts and uncles. You are key role models in every young person's life. But there are other environments and other people that they also like and enjoy spending time with. And it's really important that we look beyond our own family network and look at the community, the school environment, the clubs, the groups, the relationships, friends, family that are involved in our young person's life. And we also nurture that. You know, we might feel that, you know, as parents, we need to, I suppose, always be the person that supports and talks to our young people. And that is very, very important. But it's equally important that we encourage our children to talk to their friends, maybe talk to a teacher, talk to an auntie, an uncle, a grandparent, so they know that that network is wide. Because it might be that someday they feel, I don't want to worry mom or dad, but I would really like to be able to talk to my friend about, you know, going into secondary school or whatever it is. So what I would say is it's good to open up all these avenues of support for a young person. And then just before we move into the chat and question and answers, I just wanted to spend a couple of minutes talking to you about the different ISPCC Childline services. For any young person, they can ring Childline any day. They can go online and instant message a volunteer at Childline, or they can text. And it is a listening service. Childline is there to listen to young people, to let them voice their feelings, their concerns. We don't give advice, but what we do is explore all their options. And a young person then themselves will come up with what solution or next best step is good for them. So that's a really good tool for young people to know that if they ever just want to bounce their thoughts and their feelings with somebody neutral, that Childline is always there for them. At the ISPCC.ie Parenting Hub, we also have a wide range of articles and information up there for parents. You can access that anytime, and it's kind of put into different areas that might be of interest to you. So that might be worth having a look at any time and just seeing, you know, if there was a particular issue that's relevant to you, you might be able to gather some information from the website. And then finally, we have the ISPCC support line, which is open every day from 9 a.m. to 1 p.m. Monday to Friday. And it's an 01 number, 522-4300, or you can go online to ispcc.ie and you can make contact with the staff there. And there's somebody there that will answer your call Monday to Friday, 9 to 1. And that's really just if you have any concerns or you're looking for information, or you just want to chat through a particular issue or anything at all, feel free to contact our support line. And just to bring to you that today's webinar and the following 3 webinars, we have 2 more webinars, coming, were brought to you by the East Limerick Family Support Network. And we are made up of 5 organisations who've been working in East Limerick for the last number of years. So we have Laura Bennett in Croom, we have Jackie Hare in Kilmallock, we have Martha in Hospital. I'm the Childline Therapeutic Service. I'm a mobile service operating between East and West County Limerick as part of the ISPCC Childline Therapeutic team. And then Alice Riddler is with TUSLA PPFS team, and she is the CFSN coordinator covering Limerick City and Limerick County. So our numbers are there. If you'd like to take any of them down and you'd like to make contact with any of us directly, if you know, within your area or anything like that, please feel free. And I'll leave that up for a minute and we'll just go back to Jackie now and just see if there's any particular questions that have come up.
Thank you very much, Shellie, and thank you for such a great talk and sharing so many resources with us there on the subject of family support work that we do in East Limerick. There has been a couple of questions that have popped up, Shellie.
Okay.
So the first one is somebody stated that, you know, it's very much an ongoing issue she's dealing with, and for example, that her son has dyslexia. And that he is very smart, but due to dyslexia, his confidence has taken a hit when he started school. And he has said multiple times he's not smart. And even though he is given examples of very successful people who have dyslexia, he still thinks he's not smart. So confidence, I guess, there is very much an issue.
Yeah, and that's you know, very understandable that he's feeling maybe a little bit different and, you know, having to come to terms with maybe certain aspects of school and everyday life might be a little bit more of a challenge. And I think it's great that this person was like acknowledging other people who have dyslexia. And equally so, what I would be doing is like going back to the I have, I can, I am, is really focus on dyslexia is part of who you are, but there's also other key aspects and other, you know, parts of you that we love and we adore and are really, really positive. So I think it's to get the balance between talking about dyslexia and being able to have very open and honest conversations about how he's feeling, how it impacts on him, but also moving to look at, you know, what are other key aspects of his personality, his abilities, his interests that he can be equally proud of as well. And then that, you know, knowing a little bit about, is there support options there for him at school? You know, who could be the go-to person in school if he was having a particularly challenging day? So he knows at home, you know, who's there for him. And then at school, you know, if he had, you know, a particular teacher, or I don't know if he'll be accessing resource hours or something like that, that could be somebody that's seen as a support option for him as well.
And the exercise that you had of the hand with the different people you can speak to might be really relevant for him, that he can have that kind of plan if he has it as a visual.
Absolutely.
Thank you. Thank you, Shellie.
I think to keep talking about it and encouraging, you know, him to kind of, you know, to express those feelings and how they make him feel is very important too, that he learns that, you know, sometimes he will have these stressful days or moments of anxiety, and that they will pass and they can pass. And how do we encourage that to happen?
That leads very well, thank you, Shellie, into the next two questions, which are based on child's anxiety levels, a 12-year-old and a 5-year-old. They're two different parents, but the younger child would hide away if they're told off about anything, or, you know, if somebody is giving out. And the 12-year-old has worries all the time about growing up, death, and gets anxious at the end of the day or at the weekend.
Okay. So I think, you know, the first thing to understand about anxiety, and I know next week we're going to be having, you know, the webinar is going to exclusively look at how young people can cope and manage with anxiety and worry. So I'd really encourage anybody who has an interest and would like to know more about that to register for next week's webinar. But I think the thing to understand about anxiety is everybody has a certain amount of anxiety, and there are certain things that will make me very anxious that, Jackie, may not affect you. And likewise with children, there are certain things and certain young people who are much more prone to anxiety than others, and certain situations and events will trigger that anxiety in different people. So for the young person who gets, you know, embarrassed or upset when they have to be corrected, that maybe, you know, I wouldn't step back and avoid correcting, because it is, you know, really important as a parent that you feel okay to do that. And if perhaps they have done something and they need to be picked up on and just mention and have a chat about that, don't avoid it because you're afraid then they're going to get very upset, because avoiding that might actually make the situation worse. And for older children, you know, they do start to think about death and bereavement and loss. And it's a concept maybe that they didn't really relate to at a younger age, and it's kind of the here and now. And now with COVID, you know, every day we're being reminded of, I suppose, life and, you know, threats to our life and health. And, you know, so during COVID, you know, anxiety has increased amongst young people. So again, it's about being very open and saying, you know, I feel anxious at times as well. And there are certain things that really make me anxious. And this is what I do to try and manage it. And if you go back to those things of what can you control and what are out of your control, you know, so for the 12-year-old who might be feeling anxious at certain times of the day, certain times of the week, is trying to factor in what can they do to manage that stress and that anxiety, and what is out of their control. And also to have like things that you say to yourself, like, I know I'm feeling anxious right now, but I know this can go away. I know I can cope with this. And I know, and that kind of self-soothing talk is very, very important as well.
Thank you, Shellie. Okay, so we have a couple of more. 2.5-year-old, somebody wants to know about how to go over the ICANNs. I'm just going to answer that. I know you might have something to add as well. The 2.5-year-old is very frustrated easily and has delayed speech. The slides that Shellie has shown today, being all recorded, will go up on the Ballyhara Development website. So keep an eye on our website over the coming weeks, so you can actually review those slides. Like, I liked the tag, what was it, the care tag? And
Care tag, yeah, the I
hand graphic.
And the I am then is about kind of what things am I proud of and what things am I working on and special memories. And with 2.5 years of age, you know, what you're probably going to be doing is modeling calmness, and, you know, rather than maybe at their age, you know, talking through and working on pieces like the I have, I can, I am is very, very different. But what you're doing is kind of being consistent and talking to them, you know, in a language that they understand, and modeling, you know, pro-social behavior. So I suppose they're looking up to you and how you react to certain situations.
So that's great. Thank you, Shellie. The last question then from a parent who has two kids, very, very opposite personalities. One is very, very outgoing and confident. The other one is very, very quiet. And the eldest one is the one that's very quiet and gets into bad moods and very cross if the youngest is out at the playground. So how do you find the balance, encouraging the youngest to play and help the older to be happier in herself?
That's a difficult one, but it's also a very common one, in that it's not unusual to have siblings that are so different. And I think part of it is understanding that even though they're brothers and sisters or sisters, that they're not the same, and they are going to be very different. And by the sounds of it, you know, they are very different. So I would encourage them to be themselves, to do what makes them happy, to do, whether it's going to the playground or meeting their friends, or whether it's not and reading a book or something else, that you do what makes you happy. But also then that there might be time during the day or at the weekend where they do something together, whether it's playing a board game, whether it's both going for a walk in the park. So they develop that relationship. But it's difficult with siblings. That sometimes comes a little bit later on. You know, sometimes at a younger age, they really want to have their own identity and they really want to do their own thing. But what you can do is do certain things that they both enjoy, whether it's baking, whether it's board games, whether it's bingo, whatever it might be, that they could develop that relationship, but, you know, equally giving them time to be themselves.
Thank you, Shellie. Thanks very much, everybody. We're going to wrap it up there. I hope everybody's question is answered. I also, at the start, forgot to mention that the subject matters for these webinars that we have selected have been based on what we find is most relevant at the moment in family support work that we're doing in Limerick City and County, I guess. And also, you know, thank you, Shellie, for your input today. I loved the 4 C's, the 2 circles at the end, you know, even sharing the website of WebWise, you know, for parents who are not maybe as IT literate as their children, and they can have that extra insight into what's happening and what's on screen there for young people. Again, thank you, Shellie, for participating in this and for your help setting this up.
And you too,
it's been a great learning curve between the two of us.
It certainly has. And to all our colleagues at East Limerick Family Support, it's yes, a team effort, and you know, I'm delighted there's 2 more webinars coming in the coming weeks. And I think, you know, everybody's going to find them really interesting and come away with some really interesting ways of looking at situations and how we nurture and support our young people in our lives.
Thank you. Thank you, everybody, and hope to see you next week. Thank you. Bye-bye.